Hello, everyone. My name is Shali Prasad. I'm the Executive Director for the Center for Global Health and Social Responsibility. Welcome for this session, the Global Health Ethics in Practice session. And we are doing this in celebrating Global Health Day, which was on April 7th. First, a little bit of a background. Our Global Health Day celebrates the work done from various entities that we are engaged with. The University of Minnesota faculty, staff, and students. It's an opportunity to engage in meaningful conversations about what global health is and what the current engagement models look like. Today, we'll be talking about a very important conversation in global health. Our discussion will be with some amazing students at the University of Minnesota who were all recipients of the Global Health Ethics and Practice Awards from our center. This program, the Global Health Practice Awards, offers funding for University of Minnesota graduate students engaging in internships, applied experiences, research fieldwork, and ethical hands-on practice abroad. Now, you might ask us, is this a travel award? Well, it could be a travel award, but it is primarily to make sure that our engagement models in global health have a very strong ethical basis. And the reason we are mentioning this is sometimes universities and entities from high income countries have been accused of um, activities in global health that are not always ethically grounded. So, our push towards ongoing engagements in global health with a very strong ethical grounding is what we are trying to accomplish here. We know this was going to be a beautiful conversation. I'm looking forward to interacting with our panelists. But before we go into that, I want to give you a little bit of an overview of our Center for Global Health and Social Responsibility. CGHSR, the Center for Global Health and Social Responsibility, was formed in 2010 at the University of Minnesota. And our mission from the outset has been twofold. We want to advance global health education, training, and research. We also want to promote sound and socially responsible global health engagements. We partner with schools and colleges across the University of Minnesota to support opportunities for our folks. We also treasure long-term partnerships with entities around the world. Our center is a member of the broader University of Minnesota ecosystem focused on advancing not only global health research and education, but global health ethics too. If you notice, our center has a moniker and socially responsible and social responsibility. This is a critical part of our identity, and we want to keep striving to that name. We feel that this is a foundational piece for all global health engagements. Our conversation today is global health ethics in practice, ethical consideration from experiences in the field. As I mentioned, our panelists have all received Ethics in Practice awards. I would encourage students who are listening to this to go to our website to look at what these awards look like so they can also avail of this opportunity. We know that global health provides opportunity for enhanced collaboration and mutual understanding. We also know that navigating different cultures and societies presents complex challenges. How do we do respectful engagements in global health work? This is a conversation about the complex issues one encounters when abroad, and these challenges are often most challenging for students or researchers who are new to the world of global health. We have seen some experienced practitioners of global health also be tripped by ethical considerations. So we hope to continue to nurture these conversations going forward. To join us for this important discussion, we have three amazing panelists, and I'm going to introduce them one by one. Zainab Ahmed is an MPH student studying maternal and child health at our School of Public Health. She traveled to Boroma, Somaliland in 2025 to support a neonatal intensive care unit as part of a Global Health Ethics in Practice Award. Next, we have Ida Nanvuma. Ida is from Uganda. She's a Master's in Public Health student in Public Health Administration and Policy. She traveled to Minneapolis from Uganda in 2025 to attend the Nursing Knowledge Big Data Science Conference. And lastly, in this panel, we have Emma Pribilski, who's a veterinary medicine student, a DVM PhD student who traveled to Zanzibar in 2025 to gain hands-on veterinary experience working with licensed veterinarians. Zainab, Ida, and Emma, thank you for being here today. First, I'd like to ask each of you to explain briefly where you traveled for your award experience and what did you do while you traveled. Zainab, will start with you.
Thank you. Hi, everyone. I'm Zainab. So, for my trip, I traveled to Borma, Somaliland, and I worked in two NICUs through Amoud University there, that's in collaboration with the University of Minnesota Medical School. And I supported a quality improvement project to strengthen feeding practices for preterm and low birth weight neonates there. So I worked on designing and implementing a webcap survey and collecting baseline data on feeding practices and growth outcomes and measurements. And then I also supported a 2-week educational training for the resident doctors and nurses.
Thank you, Zainab. Ida,
Sure. So my name is Ida Nanvama, and I used my award to travel to the University of Minnesota to attend a nursing big data conference, where I was privileged to present two abstracts from my master's thesis, but secondly, to strategically also have conversations with faculty and students, because my aim, the ask at the back of my mind was to seek out for collaborations, but also for opportunities to advance my career through a PhD program at the U.
thank you, Ida. And Emma, over to you.
Yes, thank you. So my name is Emma. I used my Global Health Award to travel to Zanzibar, which is an island off of Tanzania, where I was able to work with the only animal rescue clinic on the island, to just kind of travel all over performing different like wellness exams on some of the unhoused animals that were on the island, or traveling to like different homes to be able to kind of treat their animals. So I got to do a lot of surgical experience out in the field, and just really being able to kind of practice my veterinary skills while also learning about um, just kind of the different ways of going about veterinary care in a different country.
Thank you. I just want to remind folks here who are listening that if you have any specific questions for our panelists, please put them in the chat box, and I will ask our panelists those questions. But to get us started, I know you folks went through a little bit of an online orientation module. Was there one particular ethical consideration that you ran into while you were doing your global health engagement? Zainab.
Yeah, great question. I would say one important ethical consideration I ran into was one of the things that we focused on within our quality improvement project was documentation gaps within the NICUs. These were very low resource NICUs, and documentation and patient charts were done on paper. And oftentimes, the amount of information that was tracked for each baby was varying. And sometimes we didn't have things like birth weight or daily weights on a baby that we take so much for granted here in the United States. So that definitely limited the amount of data that we could actually collect, and that limited our pool significantly. And sometimes data really aligned with our inclusion criteria, but because of something that was super unclear, we couldn't make that assumption from the chart correct. So we'd have to then exclude it. And that was a little disheartening sometimes as a researcher when you're going in and you have expectations of what you hope to find. But that was definitely an ethical consideration that I had to deal with.
Thank you, Zainab. Ida, how about you?
Sure. So for me, I'm a distance student from Uganda, enrolled at the University of Minnesota. So for me, coming in as a visiting student, I think my one of the ethical issues that I had to keep in mind was my positionality as a visiting student from a different setting coming into the US. I remember I had a number of questions for my advisor, who is actually also on the call, Dr. Rebecca, who immensely put together this trip for me. But also, I remember we had a number of back and forth questions just for me to ask what the expectations would be for me, how I would conduct myself, what is the culture like, especially for an international student coming into the US, and for me to be able to approach all interactions with transparency of the work that I was presenting from my master's thesis, but also me being transparent about my asks and the intention for why I was asking faculty or interacting with students, the reason behind my interactions. So for me, I would say transparency and how the information that I was sharing was how I was framing it in a respectful but also a very responsible manner, since I was coming into a new setting.
Thank you, Ida. And I'm going to probe this a little further. And forgive me, folks, because Ida is the student who traveled to the US. But my question for you, Ida, is you've participated in other activities, for example, traveling from Uganda to Mysore, one of our courses, and then similarly traveling from Uganda to Minneapolis. Have you noticed that the frameworks of engagement, and I appreciate you bring up your positionality as an international student, were the frameworks of engagement different in those things?
So particularly for my soul, that's a little bit similar to Uganda because we sort of have the same cultures and cultural structures. But for the US, I made sure to ask about hierarchy, but also the formality of engagement, especially with the professors. And I made sure to use titles when addressing people, use their last name. And I remember for every meeting that I had scheduled, I would have an initial debrief with my advisor just to ask about the person I was meeting. Also because I had read about their work, who they were, what faculties they were engaged in, and what their positions were. But I think having that second layer of me having that interaction with my advisor helped a lot so that I do not um, misrepresent myself as an international student, but also for Dr. Rebecca, who had done so much work for me to be able to attend um, the different engagements that were lined up for me.
Thank you, Ida. And Emma, over to you. And before you answer, one quick announcement, folks. If you have questions, please put it in the Q&A. I think I misspoke when I say put it in the chat. Put it in the Q&A and I will ask our panelists this. And Emma, in your case, I have another specific question. Quite often, when you're doing clinical work in other countries, it is a challenge. There are some significant ethical and legal challenges. So, from your viewpoint, what were your considerations when you go to Zanzibar to do a clinical exposure?
Yeah, that's a great question because that is kind of centered around like an ethical consideration that I had. And for me, it was centered around providing like what we kind of term the gold standard or high quality care. In a setting that may not have as many resources or what we are taught as to be like that gold standard of care. And so just being in that setting, like we didn't we didn't have the same access to like equipment, surgical tools, medications, or just any like diagnostic testing that maybe I would have the opportunity to like use here in the United States or just being in school. And so that did raise a lot of like questions about standards of care for me, and it was challenging to kind of like see those differences in the beginning. Um, but within like the context and like the resources that we had and working with the veterinarians there, just kind of learning to like adapt and having an open mindset that like the standard of care is different everywhere you go. So it's not necessarily what I think or maybe exactly what I'm taught, but it's different for everybody. So again, just kind of learning to be like resourceful, respectful, and just having that open mind about, given the resources that we have, like we have to kind of center that around, the animal that we're treating, and just taking that into consideration. So I was with other veterinary students and we all kind of had the same kind of like mindset on that, like throughout the whole experience. But
It's an important part of the immersion, isn't it? How do we get to the point of understanding what the local situation is and how do we do this? There's a question from the audience, and this has got to do with how do you get a clearance to practice in Zanzibar? And I'm assuming that's under the supervision of other veterinarians. So if you want to, can you answer that, Emma?
yeah, that's a great question. So I think as um like we were working with a veterinarian who had gone through schooling in Africa and had gotten licensure there. For me, I'm protected through like US standards and like I have, insurance as like a vet student. But going there, not so much. I don't have any like way to be able to be like, yes, I'm a licensed veterinarian. I'm just a student. So it was really up to the veterinarian and like the clinic on what I was able to do. But that being said, like they're very open to having lots of people come and just kind of treat and learn because there is such a high volume of animals that they take care of and have to see on a daily basis. So I was just able to kind of do what I was able to do with like the veterinarian. And again, that comes down to the different standards of care there. Like some of the things I did there, I probably wouldn't be able to do here, which is like kind of a reality of it. But there, the more help, the better. So,
But I appreciate you bringing that. You're still working under the license of that veterinarian
yes,
there,
yes.
so which is the supervisory aspect, which I think is an important part, right? We talk about, engagement in the global space as a learner and what would that look like, and working with that other veterinarian. I think it's a very important part. Thank you. Um, One question I have for you all is, we all always talk about, when you go in a global health engagement framework, you learn a lot. But is there something that you had to unlearn? So, Zainab, I'm going to come to you with that.
Yeah, definitely. I think the first thing that comes to mind with unlearning was that I'm Somali, so coming this is actually my first time going back home for me, but I speak some Somali as well too, and I think I had this expectation that I would experience maybe some culture shock, but maybe not as much as I did experience, and a lot of that came with linguistics and not necessarily feeling as confident being in Somaliland and country as I do with here with friends and family and similar to what is it like Spanglish where people speak Spanish and English and intermixed it. Like I do that often with Somali and English and not having to do that as much in country was something that I had to very much unlearn. So it was almost like catching myself and learning like slang and certain terms in the region that we were in as well too, which is a little farther from the region that my parents grew up in. So just a lot of linguistic unlearning and learning and adjusting that I didn't expect to learn, but it taught me a lot.
Yeah. And Aida, how about you?
Sure. So for me, and I think this is both in my soul and at the U of M, one important thing I had to unlearn was the tendency to view global health through a deficit-based lens. And before arriving, unconsciously we associate the global south with a resource limited, it's a resource limited setting, primarily what people usually present as the gaps and challenges and the not so good things to really learn about a place. And but however, after engaging with different fellow nurses at the conference, I quickly learned that it is actually not the case. Global health, I think, should help us remove these labels so that we can then shift our perspectives into recognizing and valuing existing strengths, so that way we can use the assets that we have in different communities to come up with locally driven solutions. So yeah, I think that was my experience.
I appreciate that, Ida. I had a colleague actually from Uganda um, use the term global majority, not the global south. And I found that fascinating for very important reasons because I think it takes away from that deficit mindset, isn't it? It's like it shouldn't be that, oh, those poor people have nothing, but sort of celebrate what's going on, understanding culture, understanding opportunities, understanding ways of practice and other things, because otherwise we tend to have a tendency that what we have in a high income country is the right answer. And we know, as a practicing clinician here in the US, our health system is not ideal for various reasons. So that's a beautiful point that you bring up. Thank you. Emma, what about you? Are there things that you had to unlearn?
Um, yes, I would say, um, I know there's like a question in the chat also too, but um, I guess for me, I kind of touched on it earlier, but it goes back to like the quality of care. It looks different everywhere you go. And so I kind of had to unlearn that less resources, I guess, doesn't necessarily mean lower quality care.
Mhm.
And like working on Zanzibar, even like it was just for a week, but during that time, I just really learned that care just looks different everywhere. And so like just specifically for my experience, tertiary medicine can still be highly effective. It can be ethical and very impactful, even without like the tools that I'm necessarily used to um, like using or learning about, as long as, there's like that common goal of like treating the patient, helping the community, and just being committed to that common goal. So,
Thank you. I appreciate that. Um, is there one thing that you would have done differently, knowing yourself now after the experience? One thing you would have done differently, either in preparation for your global engagement activity or during your time in the place that you've traveled to? And Ida, I'm going to start with you this time. I'm just going to change the cadence a little bit.
Sure. So looking back, I think I pretty much prepared well for the two visits, but maybe what I would have done better is to um, mentally prepare for the conversations,
Ah,
because without information about a place, there's going to be a limitation in your submissions, in how you engage with people on a deeper level, and it's going to determine a number of things. So um, while I did well with the university conference visit, I feel like I should have done more with my soul. I think I took it for granted that because we sort of have a similar cultural setting or structures, that most things were going to be the same, which was actually not the case. So in that way, I think that is one thing I would have done differently, to prepare more, and to understand deeply what, India is all about, what they offer, what are the settings, what are the similarities, what are the differences, how can I represent where I'm coming from in a much better way, respectfully, but also culturally aware of what was in India, so that I sort of don't, go off the track. Yeah.
Yeah, wonderful. Zainab, what about you?
Yeah, this is a great question. I don't know if I would have done anything differently. As I said, it was my first time going in country to Somaliland, so I think I just came in knowing that I was going to learn a lot, and I listened a lot to people, and we had a lot of conversations with people, whether that be like in the hotel we were staying at, people who came to say hi that were traveling, or people within the hospitals that we visited and we like worked in. So I think I just learned a lot in my first visit, and I think I would come in a bit more confidently next time, and be able to build on some of those connections, and maybe like have more confidence speaking to more people and networking, given that I had some experience next time I would have experience next time I come. So yeah.
Yeah, wonderful. I think I appreciate two important parts of what you mentioned, Zainab. Obviously, one is that intellectual curiosity, isn't it? That you are there. And inherently in what you said, there is that humility point that I'm here to learn, I'm here to learn, I'm here to learn. And I think that's a very critical point of an engagement framework in global health. I really appreciate that. Emma, how about you?
Yeah, it's similar to Zainab and what she is saying, but I wish I had prepared more for just maybe some of the communication barriers or language barriers on my part. In Zanzibar, they mainly speak Swahili, and I actually have a few classmates that know Swahili, and so I wish I would have utilized their help a little bit before going. Um, Everyone there was extremely friendly and welcoming and was very like many of them knew how to speak English, but I wish I would have been able to make that like connection, I guess, like sooner, in a way of me being able to like speak more basic like Swahili phrases and just showing that like I took that initiative to do that. I did learn throughout my week there, but I wish I would have kind of done that more effectively from the start. And again, having that like confidence going in a little bit more too.
Thank you for that. Now I'm going to combine a couple of questions. Mariam Khan has a specific question for Aida about your travel to the US, particularly with the current situation in the US, cultural, political, social, etc., etc. Did you find that shocking? And what are the things that you'll unlearn about the US? And this is for the rest of you folks too. When you travel outside the US, what are the things that you unlearned, particularly from the viewpoint of this notion that the US should be a leader in global health, which we are not. So, what do you folks? What was your experience like? And Zainab, I'm going to start with you this time. What is it, and particularly during your travel, did you get a sense that there was a um, almost like a argument that you guys don't know all the answers? You shouldn't be the authority on this.
Do you mind repeating that last part? I think it cut out for me
So
just a little bit.
yeah, so when you travel, did you get a sense that there was a pushback about the US, or that US shouldn't be considered to be an authority in global health?
Yeah, that's a great question. I think I was fortunate to join this trip. The doctor I worked under for this trip, Dr. Diego, who's also on this call, has been going to the same NICUs for the past 2 to 3 years before I was able to join her this past summer. And I think that helped because there was already an established relationship that was kind of grown between the medical interns and the staff that have been there for a couple years. And I'm sure that it would be different if it was all of us as a team going in for the first time. But
Yeah,
I think 100%, um, there are some things that I like you really learn, I feel like when you're in country and you're representing the United States. I think some folks even had conversations with us while I was in country and um, afterwards when we're doing these virtual meetings on like the safety of things in the US and how are things politically for us. And I think oftentimes people want to have a lot of conversations when you're traveling globally on like the safety of traveling and going to a different country, but there are also so many worries that people have people perceive about the US as well too, and living in the US and how is it like within your healthcare system. So it's like there's two sides to a coin, and you don't see that until you're having these conversations.
Excellent. Emma, how about you?
Yeah, I would kind of mirror exactly what was just said. Like for me, the clinic that I went to was kind of it was owned or started up by a German lady, and so she was more familiar, I would say, with like the US system, but I also like the doctors and the volunteers that I worked with as well would also kind of bring up conversation of like US politics, things like that. And so, just maybe like if you comfortable being comfortable talking about it, not talking about it, but like everyone has their own kind of like viewpoint. And so being able to have those like, I guess, conversations if you're comfortable with them. It wasn't really a problem for us, but it was just like interesting, like learning, I guess, more specifically for like veterinary medicine and how their system works from like starting out from like going to school and how they get accepted into vet school and like what age. And so like kind of learning about that global health dynamic on how they are able to kind of admit students into their veterinary schools versus how we do it. There's a lot of discussion around that. Um, but yes, I would say like politics definitely came into play. So, I mean, it was just kind of going into it knowing that that might happen, and just kind of being prepared, to be asked questions. And yeah, that's all I really have to say about that. I did want to just really quickly, if I'm allowed to, just talk about like the students going into clinical settings and
Yep.
respecting host country standards.
Yep.
I didn't necessarily say this. I probably skipped over it, but like um I did have to submit like my accreditation for being in like a vet school and all that stuff, and like I had to do a whole bunch of background paperwork. And so again, too, it was based on their comfort level of me doing things, and I was always supervised. So I would like to say that. But yes.
Thank you, Emma. I appreciate you bringing that up because we are particular that we don't, not just from a learner perspective, look at going abroad as from, hey, I'm licensed in the US, so I can do work anywhere, any way I
Exactly.
want. So I really
Yeah.
appreciate that point. Um, Ida, what about you? The power differential and particularly the challenges of, more than the power differential, the challenges of traveling during this particular political and social upheaval that's going on.
Sure. So at that time, I remember as flying in from Uganda to Ecuador and then to the US back to Uganda. And by default, I am a black female, uh, unmarried, no kids. So usually people mistake that with such, characteristics of a person, if by any chance get entry to the US, them not, returning back to their countries
Yep.
of residence, and by, default, I always get the second check, the side room check, the extra swipes with my laptops and gadgets. So that had sort of like I'm sort of used to that. At some point, I used to have issues with it because you can never tell who has what intentions based on their, the color of their skin or how they present themselves. But coming in this time, luckily it was before the administration had tightened. It was, I think, going to that cycle where there were a number of changes getting in place. But luckily, I think I had a smooth immigration experience. I got there in the morning. Maybe that helped also. I answered the questions that were, presented to me, and then I was given access to the US. I entered and then got out safely. Yeah, so it's I mean it's sort of unfair for people to have such assumptions, but then the extra preparation that was done for me by the School of Public Health, but also by the center on how to respond to what question and where to not give explanations if not asked, and and just to have Anna on speed dial in case something went wrong, or just moving with a group helped a lot. So in a way, I blended in and I didn't really have much trouble.
Thank you. The Anna that Ida is mentioning is one of our amazing staff members here at the Center for Global Health and Social Responsibility. Thank you. I want to bring up something that Zainab, you brought up, and I'm going to compliment your mentor. I know she's listening, Dr. Diego. I appreciate what you mentioned, that Dr. Diego has a long-term relationship with an entity in Somaliland, and she keeps going back and has been working with people. And I think that's a very critical point, isn't it? The development of that relationship in a long-term partnership framework, which I really compliment Dr. Diego. And obviously, you're going there as Dr. Diego's team members. One of the follow-up questions I have for that is, while you're doing this, while you're doing a rotation, an experience, an engagement, even if it is in the context of a long-term relationship, understanding that your role might be transient, how do you deal with power dynamics? How do you deal with the premise that you come from, we, all of us generally, come from privilege? The opportunity itself is a privilege. We sometimes carry our own privilege of the university, of the US in the global space, though that might be changing right now, and other such privileges. So, how do you handle that? Zainab, over to you.
Yeah, what a great question. I think for me specifically, um, I that's such a good question. I think as like an MPH student on her first field experience, again, I was coming in as such a learner that
Mm.
this privilege of maybe our systems that we have in terms of medical systems and educational systems almost didn't matter as much as me being in context, right? And from those who are practicing as nurses and doctors in the field and in country, and learning from them and how things work there and what practices are held there and what the schedule is like there. So I was privileged to learn from them and for them to be able to see me as a student who was just eager to
Mm.
soak in like information and for them to teach us. I know even for Dr. Diego, who's been several times, each time she learns so much about how practices are there. And this time around, we learned so much about nutrition practices and feeding practices and why is this a limitation and why is, oh, there was a new policy that was just recently in the hospital. So that affects like this resource. So that also affects this nutrition practice. So I think that is, I guess, how I approached it.
Thank you. Emma, I know your experience there was relatively brief, right? 7 days. How do you make sure that the power dynamics don't manifest as a superiority, if you will?
Yeah, absolutely. I think like coming in as an international student, coming into like a local system, especially with it being on an island, like the place I went to specifically was used to having like students coming in and out pretty much every week on a rolling basis. But again, I like Zainab was saying, I came in as an eager student, like ready to learn, keeping an open mind and not kind of like undermining their expertise. Like I'm just a student, right? Like this is a veterinarian, so making sure that I was like I'm ready to learn from you. I want to learn from you, listening. Um sure, like maybe going out into like the non-clinical setting was a little bit different and just, like being a white woman walking around was like that was different for me because I had never really been out of the country before. But just again like kind of prioritizing like that humility and respecting like the local culture and where I was, and that again, it was really just a privilege to go there and just kind of, see a different setting. And so just kind of being mindful of that. And then like again, just I was really grateful and I tried to be like kind of show how grateful I was for being there and for just like learning. So
Yeah, thank you. Um, I'm going to ask this question rather provocatively. With all the challenges going on around the world, with the travel has gotten more expensive, it's gotten more fraught because flights get canceled, they're not going through the Persian Gulf, etc., etc. Potential challenges of being stranded. Ida, your concern about visas, and I acknowledge that a lot of times when from the US we don't understand how difficult it is to just even get a visa. So all of that. With all that, would you folks still recommend that students engage in global health? Why or why not? And if they do, how would you recommend they approach it? And Ida, as somebody who's experienced some of those visa challenges, I'm going to ask you to get started with this.
So, um, that's an interesting question. But one thing I would say for sure is there's always going to be challenges. If you're still living, challenges is part of the life that we live. And I think it's the mindset that helps all of us maneuver the challenges that we have. Um, and I remember trying to get to my soul. I thought it would be easier for me to get to my soul than it would for me to get to the US, but it wasn't the case. I still had to prove a number of things with a
Right.
couple of visa denials here and there. But one thing I would really recommend, or my advice to those who are interested in global health is to sort of um, emphasize that it's worth it. It's worth the experience, first of all, and just to encourage those that are, anticipating to explore this concept is to sort of just approach it with humility, curiosity, and willingness to learn, but also to listen to others, and to also to sort of keep an open mind. We usually have assumptions about different places. We sometimes think uh, different things of different places, but global health, I think, gives us a fair platform for all of us to tell our stories, because if we do not tell our stories, then other people are going to tell these stories on our behalf. And most times it's not true. What they're saying is not true. And I'm saying this because I had an experience at the conference. Uh, by the way, I was the only Ugandan there. And people were surprised that I had more than one abstract. For me, it's normal because I have a research background, so that's business as usual. But also because I remember in one of the discussions, one of the participants had a lot to say about Uganda. And because they had a daughter who had come to Uganda and helped build a well, so therefore the biggest challenge that Uganda had was access to the roads. And it's not the case. So I had to, and I had to sort of tell my side of the story, because if I left it at that, then everyone else would have left that place thinking that, the biggest challenge we have in Uganda is access. We don't have roads. So just to sort of approach global health with an open mind, with the curiosity of wanting to learn from others, because it's not a one size fits all. It's going to be contextual, locally, driven mindsets that are happy to sit together on a round table with others to learn with, but also from the rest.
Thank you. I appreciate that. It reminds me of the Nigerian writer Chimamanda Ngozi Adichie's comment about the fallacy of a single story. She feels that sometimes when we use anecdotal stories, people get trapped into a mindset that that single story is the way everything is. So I appreciate you bringing that up. I think there is enough diversity amongst humankind for us to be open to the idea that there are more than one narrative. So I appreciate that. Zainab, what about you?
Yeah. So, what I encourage people or students to take on global health opportunities and travel, given this context. I think everyone should assess like their own safety risk, and I know everyone's experience will be different given their background and their identities and where they're going and the context of where they're going. However, there are so many resources also as students that we have access to help with safety. Personally, I like developed a safety plan where I spoke about how I am going to communicate with Dr. Diego and the team members and who like if I ever do need to evacuate for any reason, what do I do? And I was in touch with someone from the University of Minnesota who focuses on like travel advisory, and we could always contact him if there were like stops in the road for us specifically. It was like airports and looking at those stop points in airports and yeah, that really helped me, I think. And I would definitely still encourage students to take on global health opportunities and travel. As Ida said, like you learn so much from traveling. And I think something that I encourage is to just put yourself out there and communicate with people as much as possible. I consider myself a little bit of a shy introvert person, but when I travel, I try to push myself to talk with people as much as possible because it's those people that you communicate with at the airport, at the cafe, at the restaurant, at the hotel, and then at the hospital that help you along the way. And you can always ask them like what to do, right? So I'll just even share, I like hurt my hand a little bit when I was in country there, and I had no idea which pharmacy to go to, where to get like simple wrap, where to get like simple like pain reliever. And it was just another medical student who directed me to the pharmacy. And then I spoke with someone at the hotel about the traditional hours. How will that work when we have to be at the hospital at this time? So it was those connections that I made that really were super helpful and made me feel a lot more safe and taken care of. But that wouldn't have happened if I didn't try to like initially communicate with them before.
I appreciate you mentioning that it's almost inherently true that any global engagement is immersive and will bring you to the limits of your comfort zone. And I like one of my friends used to say, it's you should never call it the comfort zone, you should call it the growth zone because it stretches you from that comfort to the growth, right? So yeah, I think that's a beautiful point. So uh, two out of the three have said yes to travel. What about you, Emma? No pressure. No.
Oh yeah, no, I would definitely say take advantage of global health opportunities, especially with a great program like this that can provide support for allowing you to go somewhere. Um, I I hadn't even really considered it until I had learned from other people, especially just in my veterinary medicine program, that they were going all over the world and having like amazing experiences, not only with like animals, but with like the culture and their experiences and what they got to learn. And so, I would recommend it. And like my big piece of advice for doing it is again, kind of, um, piggybacking off of what the other two panelists said, but is to really just to go in with humility and an open mind. Be ready to learn more than you expect. And don't assume, at least in my position, that your way of doing things is the correct way, that the world is like full of different minds, different ways of doing things. And so just going in with that open mind of learning and engaging yourself in what you can. They're incredibly valuable for building like your confidence, for becoming more adaptable, having that like cultural awareness, and they can like really shape how you kind of approach your life from like long term. Like I will never forget the experience that I got in Zanzibar, and so it really does kind of shape my new way of thinking about like veterinary medicine, and I really hope to be able to like travel abroad again in the future. Um, Hopefully just, whether it be as a student in the future or as like a working vet. Um, but yeah, I think that answered the question. I hope.
Yeah, thank you, Emma. I'm
Mhm.
going to combine a few of the questions because there's a common thread in all of this. One is about how do you choose where to go and what that experience is going to be? And as an add-on to that, Would you recommend traveling on your own, which has its own positive challenges and experiences? And or would you recommend that you be part of an organized course, for example, or something else like that? So, two questions. How do you choose an experience, both from an experiential viewpoint and what country to do that in? And then the second point, is it as an individual travel experience or as an organized course experience? Ida, how about you?
Sure. So for me, I think what made it easier for me to choose which places to go was one, with my advisor, Dr. Rebecca, and I'm going to keep referring to her. We used to have, she's also my mentor, by the way. So we used to have, um, and I'm saying we used because I am done with my MPH. Yeah, but we used to have routine discussions of what I was passionate about, what my strengths were, what my goals were, career goals, and where I would see myself in the next couple of years. So with with such discussions in mind, when I went to her with this opportunity that I had seen, she was quick to notice that this would actually be a good opportunity for me to apply to go to the university, attend the conference, especially the nursing big data conference, because informatics is my passion. So she was quick to link my desire and the available opportunity for me, something that I was not even aware of. I was not even aware of the conference, by the way. So she was quick to link the two for me, and also she helped plan everything. So once I put in my application, which of course she was a co-investigator, and luckily we got funded. The rest was easy to plan and also implement. So I guess what I'm trying to say is have a mentor, talk to them about what you want, where you see yourself, what you want to do, what available opportunities there are, and see what their recommendations are. And then in terms of traveling solo versus in a group, I would recommend traveling with a group, especially if you're going into a new environment or setting. One, because it takes off a lot of tasks off of your shoulders. There's someone planning the trips for you. There's someone waiting for you on the other end. I remember in India, lots of my flights got rescheduled without me getting informed, but because um, there was someone in India waiting for me who kept, checking in on me with every other step that I was at. It made it simpler. I got there in the middle of the night. They had someone to pick me up, someone to take me to the hostel, someone to bring me something to eat. So I was not worried of how I was going to get from the airport to the hostel or where to find food. Someone else was worrying about that. My only task was to get to India, which really happened. So I would recommend group, especially if it's a new setting.
Um, Dr. Wertz, Rebecca Wertz is a mentor for all of us, Ida, so I completely acknowledge. By the way, congratulations on finishing your MPH work, and Rebecca is also congratulating you. Zainab, what about you? How would you do this decision?
Yeah. So I'll answer the first question on how you find an opportunity and how I chose my opportunity and how would you choose an opportunity. So I think, as Ida said, it's important to understand your interests, whether that be topic interests, if you have interest in a specific population, regional interests, sometimes that overlines with topic interests, and what type of work have you done in the past, and what do you hope to do as like within the rest of your degree, and how will an experience add to that. So
Yes.
going in, I already had some experience doing some research on like malnutrition in mothers and children in Somalia. So I really wanted, if possible, in my master's to find um, faculty member who was doing work in East Africa, and that was the population of interest for me. And my MPH concentration is in maternal child health. So I simply started with a Google search and wanted to look to see if there's any faculty doing work in that area. And I just happened to find Dr. Diego and her website, and that she worked in NICUs in Somaliland. So that was very aligned. And my past research was on nutrition, malnutrition, and this time for a quality improvement project, the focus was on nutrition. So it just happened to be a little bit of luck, but I just did cold emailing. So I would definitely encourage that and just do a Google search, see what type of work is being done at our university, even if it's outside of your school. And for traveling alone versus with a course, I didn't actually travel with like a course. It wasn't one of the school public health like courses where they're traveling with a bunch of other students. It was just me, Dr. Diego, and a neonatal nurse practitioner. And I felt comfortable doing that because I established a relationship with them and I met with them a lot like online and in trainings in person before I traveled with them. And I really enjoyed my experience despite being with a group of students. But if that's something you're looking for, then definitely consider some of those courses that have that experience as well too.
It's amazing how both Ida and Zainab talk about getting good mentors, and you got really good mentors, Rebecca Wirtz and Ellen Diego. So congratulations on that part too. Emma, how about you?
Yeah, for me, I chose an experience actually that was very outside of my comfort zone. Just to kind of like I'm kind of to put into words a horse person, so I'm very much horse oriented. And so I was like, I kind of want to do something that's like very outside of my comfort zone, which was like dog and cats, just doing basic wellness care. And so I was like, why not? Why not just go do something that maybe I wouldn't necessarily pick as my like number one thing, but I knew it would give me that cultural experience, that travel experience, and just again learning something completely new. So I kind of just ended up going with that. And for that reason too, I had other veterinary classmates that were interested in the Zanzibar program, so that kind of helped influence my decision, which I would then recommend. Like for me, I wanted to go in a group just because I don't know if I would have been comfortable traveling that far by myself for like the first time. Maybe if I had done it before, like in the past, I would have been more comfortable. But having like three other people go with me, I knew that, if things do go not as planned, like at least I have other people to figure it out and we can, put our minds together to kind of, find a solution. And again, too, it was kind of an organized program, so lots of people to kind of contact or fall back onto, or we always had someone who knew where we were at all times, like kind of an itinerary type deal.
Right.
Um, which that for me was settling, like knowing like, okay, someone knows where I am, so if they don't hear from me, then
That's
maybe
a
they
safety
should,
part. Yeah.
yeah, maybe they should like figure out where I am. So, yeah, that's kind of where I am. But again, you have to kind of assess your own comfort level, what you're hoping to get out of a global experience, and just kind of going from there. And there's lots of resources online too that can help.
Thank you for that. We are running out of time, and I really appreciate the time you three have put into this. I appreciate the engagement, but I'm going to transition us directly to a couple of quick slides. Jake, if you can share that. Yes. One is about upcoming opportunity, and hopefully doesn't sound as a commercial break, but we have some opportunities from the Center for Global Health. We have a course we're developing in Thailand in January of 2027. Information session for this will be held April 30th, 2026, from at noon. We have a course we run in Ecuador, which the next iteration of which you will be eligible to participate will be in May, because I think we've already set the stage for this May, May of 2027. Please look out for that. You can do independent study with our center, and you can also apply for this Ethics in Practice Awards, the next round of which are due June of 2026. We offer them twice a year. And next slide, please. Please reach out to us. I would strongly encourage you to fill a post-event survey. We take the information we get in the post-event survey very seriously. And also look up our website for other ways to engage with us. Be part of a listserv. Reach out if you have any questions. We are here for the University of Minnesota's global health activities. I want to specifically thank my team for putting this together. All of my team members have been very instrumental in putting this together. Thank you. and also to donors who made the funding for these awards possible. If you want to be part of either one of that, particularly on the donor side, we'll be happy to take you. Otherwise, looking forward to future engagement. Thank you all.